Hello everyone. In this lecture, we are going to look at infant nutrition or nutrition during infancy. And this is our 5th class in the Nutrition Through the Life Cycle series. Assessment of newborn's health. A newborn's health can basically be assessed using the weight, the length, the head circumference, and the chest and abdominal circumference. The weight. The average birth weight for babies is around 2.5 kilograms to about 3.8 kilograms. Boys tend to weigh heavier than girls, and first babies are usually lighter than later siblings. Large parents generally have large babies, while small parents generally also have small babies. Children of less or greater than normal birth weight can suffer from hypoglycemia. This is a blood glucose concentration of less than 35 milligrams per deciliter, or a plasma concentration of less than 40 milligrams per deciliter, just a few hours after birth. And this can be eliminated by breastfeeding the infant or intravenous injection of glucose if the child's insulin levels are persistently high. Newborns often lose around 8 oz, that is 226.8 grams of weight in the first 4 to 5 days after birth, but they are able to regain this by about 10 to 12 days of age due to consistent breastfeeding. In the first month, the typical newborn gains about 0.7 oz, that is 20 grams a day, or about 4 oz, that is 110 grams, to 8 oz, 226.8 grams a week. A baby's weight will double his or her birth weight by about 5 months of age. From ages 6 to 12 months, a baby gains about 3 to 5 ounces. That's about 85 to 140 grams a week. And by the time a child reaches about 1 year, the weight triples his or her birth weight. If a child was born with 3 kilograms, by the time they reach 1 year, they are able to weigh about 9 kilograms. The standard newborn growth assessment. We have 3 major terms that describe a newborn's weight that is appropriate for gestational age. This is a child that is born with a normal weight. Then small for gestational age, SGA, and intrauterine growth retardation. This means that a newborn was less than 10% of the weight. Large for gestational age means the newborn was greater than 90% of the required weight. Assessment of the length. The length of an infant depends on the neonate's birth weight, gestational age, and it may also depend on the height of its parents. The normal length of a newborn will vary from about 47 to 54 centimeters, and the average is around 50 centimeters. From 0 to 6 months, a baby may grow a half to 1 inch, that's about 1.5 to 2.5 centimeters in a month. And from 6 to 12 months, a baby may grow 3 out of 8 inches, that is about 1 centimeter a month. To measure the length, the centimeter measuring tape is applied to the point which marks the top of the crown at the top of the head, and it's drawn till the point that marks the neonate's heel below the feet. The head circumference is also considered to be one of the most important indicators in a neonate's anthropometry. The normal head circumference of a term newborn is 33 to 35 centimeters, and the average is about 34.5 centimeters. The growth rate of the head circumference reflects brain growth. To be able to measure the head circumference, the centimeter measuring tape is applied around the head, the occipitofrontal circumferences. Microcephaly is a condition associated with a degree of mental retardation. This is an abnormally small head of an infant. And this can be likely caused by the following conditions: chromosomal disorders, for example, Down syndrome; maternal viral infections, for example, rubella or German measles; maternal alcoholism or drug abuse; maternal diabetes or gestational diabetes; mercury poisoning; uncontrolled maternal phenylketonuria levels; and maternal malnutrition. Macrocephaly refers to a condition where the head of a child is abnormally large, and it is attributed to some conditions, for example, brain tumors, intracranial bleeding, chronic hematomas, and other lesions. Haller syndrome. A child can have delays in reaching the learning milestones due to mental retardation. Chest and abdomen circumference. In the term newborn, the chest circumference is approximately 2 to 3 centimeters smaller if compared to the head circumference, so 30 to 33 centimeters. A small chest circumference indicates developmental immaturity. The abdominal circumference ranges from 30 to 33 centimeters. A larger abdominal circumference will indicate intestinal blockage or high abdominal mass. To measure the abdominal circumference, the centimeter measuring tape is applied below the axilla on the neonat's nipple line. Precautions. Prior to the performance of measurements, it's very necessary to wash the hands thoroughly. Ensure antisepsis of the measuring tape by using alcohol solution of 70 degrees for disinfection, and this ensures that the infant does not get infected with any kind of infections around her or him. Heat loss of the naked newborn is prevented by assurance of a warm environment. Other important things to note for a nutritionist to check: the skin. You can check for jaundice, which usually indicates an increased hemolysis, and ABO blood group incompatibility, and also rhesus incompatibility. Edema on the hands and feet of the infant is a sign of overhydration. Infant mortality. This is defined as death that occurs within the first year. The major cause is usually low birth weight of less than 2.5 kilograms. Other leading causes may include congenital malformations, preterm births and pneumonia, diarrheal infections, and malaria. Combating infant mortality. The factors associated with mortality include social and economic status. If the social and economic status of a parent improves, then it's possible that infant mortality rates will also be reduced. Access to health care. If there is poor health care services, there's going to be high infant mortality rates. Improvement in health services will also imply reduced infant mortality rates. Medical interventions. Delayed medical interventions in case of sickness of an infant may increase the mortality rate. Teenage pregnancy. Teenagers usually give birth to children that are low birth weight, and these children are at high risk of infant mortality. Availability of abortion services. This increases the infant mortality rate. Failure to prevent preterm and low birth weight births. Infant development. Newborns. A newborn is able to hear and move in response to familiar voices. The central nervous system is still immature, and this results in inconsistent cues for hunger and satiety. There are strong reflexes, especially the suckle and root, which are protective for the newborn in order to get enough breast milk. Terms related to development. Reflex. This is an automatic response triggered by specific stimulus. The rooting reflex. Here the infant turns the head toward the cheek that is touched. Suckle. This is a reflex that causes the tongue to move forward and backward when the mouth is touched. Major reflexes found in newborns. These are some of the major reflexes that you can find in a newborn baby. Babinski. In this, you find that a baby's toes fan out when the sole of the foot is stroked. And the significance is it helps, perhaps it's a remnant of evolution from heel to toe. The blink. A baby's eyes will close in response to bright light or loud noise, and this protects the eyes from any dangerous substances. Moro. A baby throws its arms out and then inward as if embracing, and this may help a baby cling to its mother in response to a loud noise or when its head falls. Palma. A baby grasps an object placed in the palm of its hand, and this is a precursor to voluntary grasping. Rooting. When a baby's cheek is stroked, it turns its head towards the cheek that was stroked and opens its mouth, and this helps the baby to find its nipple. Stepping. A baby who is held upright by an adult and is then moved. This is a precursor to voluntary walking. Then this begins the walking process. Sucking. A baby sucks when an object is placed in its mouth, and it's also important in permitting feeding. Withdrawal. A baby withdraws its foot when the sole is pricked with a pin, and this protects a baby from unpleasant stimuli. Motor development. This refers to the ability of an infant to control voluntary muscles. And the motor development is top-down, controls the head first and then the lower legs last. Muscle development from central to peripheral influences the ability to feed self and the amount of energy expended. Gross motor skills. These are some of the gross motor developments that occur in infants from birth up to about 15 months. At 0 months, the child usually remains in fetal position. At 1 month, the chin is placed up. At 2 months, the chest gets up. At 3 months, the baby can reach an object that is far away from it, trying to reach that object. At 4 months, the baby can sit with support. 5 months, it can sit on the lap and grasp an object. At 11 months, at 6 months, the infant is able to sit on high chair, grasp dangling objects. 7 months, the baby can then sit alone. At 8 months, the infant can be able to stand with help. 9 months, can stand holding furniture. 10 months, the baby starts to crawl. 11 months, walks when held. 15 months, 12 months, the baby is able to pull to stand by furniture. 13 months, climbs stair steps. 14 months, stands alone, and then 15 months, the baby starts walking alone. But all these depend on the status of the child during pregnancy and also at birth. Some infants will develop these milestones much later than others, and others may develop them much earlier than others. Critical periods of infant development. This is a fixed period of time in which certain behaviors or developments emerge, and it is necessary for sequential behaviors or developments. If the critical period is missed, there may be difficulty later on in life. Sensorimotor stages of development. These are the sub-stages during the sensorimotor stage of development. Stage 1 up to 6, and then the ages. From 0 to 1 month, the reflexes become coordinated. For example, sucking a nipple. From 1 to 4 months, primary circular reactions appear. An infant's first learned reaction to the world, such as thumb sucking. From 4 to 8 months, secondary circular reactions emerge, and this allows the infant to explore the world of objects. For example, shaking a toy to hear a rattle. From 8 to 12 months, this means an end sequence of schemes is seen, marking the onset of intentional behavior, for example, moving an obstacle to reach a toy. From 12 to 18 months, the tertiary circular reactions develop, and this allows children to experiment, for example, shaking different toys to hear the sounds they make. From 18 to 24 months, symbolic processing is revealed in language, gestures, and pretend play. For example, eating pretend food with a pretend fork. Digestive system development in infants. A healthy digestive system is very important for successful feeding. Parents may worry about the gastrointestinal problems, in part because of misinformation about nutrition in infancy. For example, an infant with soft, loose stools may be considered by the parents to have diarrhea if they do not know that this is typical for breastfed infants. Another common example is parents being concerned that their infant's gastrointestinal discomfort may interfere with weight gain, even though growth usually progresses well. And it takes up to 6 months for the infant's gastrointestinal tract to mature, and the time required varies considerably from one individual to another. Although healthy newborns do not have the same levels of digestive enzymes or the rates of stomach emptying as older infants, the gut is always functional at birth. At birth and through the early infant's period, the coordination of peristalsis within the gastrointestinal tract improves. Maturation of peristalsis and the rate of passage are associated with some forms of gastrointestinal discomfort in infants. Common problems that show immaturity of the gut may include gastroesophageal reflux, colic, diarrhea, and constipation, and these conditions do not interfere with the ability of the intestinal villi to absorb nutrients and also typically do not hinder growth. Other factors that impact the rate of food passage in the GI and discomfort include osmolarity of foods or liquids, which affects how much water is in the intestine, colon bacterial flora, and water and fluid balance in the body will also determine how much water is absorbed. Parenting. New parents must always learn infants' cues of hunger and satiety, and also the temperament of infants, the infant's emotional reactions to new situations, activity level, and sociability. How to respond to infant cues. New parents may also take long to recognize that the newborn is more comfortable nursing at one noise level in the home than at another. So you find that new parents need to be supported in responding to children's cues. So basically this is what we have for the stages of development in the infant. Thank you.